Welcome to Building Trust and Relationships with Diverse Populations. I'm Rhoda Weiss, National Healthcare Consultant and Speaker, chairing Becker's C-Suite conferences in this new one on patient experience and marketing. It's no surprise inequities and systemic injustices lead to health disparities among those marginalized due to race, ethnicity, gender, sexual orientation, age, ability, socioeconomic status, religion, and geography. We also know where you live can dictate how long you live. Today's panelists from leading health systems share how they're working to reduce structural, racial, and cultural barriers to health, achieve equitable, culturally sensitive, patient-centered care and outcomes, create data-informed health equity strategies, implement practices to resolve root causes of health disparities, foster culture of continuous learning and transparency, and use their voices to speak out against structural racism and injustice to address this ongoing public health issue. First, let me introduce Karen Ashley. She is Associate Vice President for Diversity, Equity, and Inclusion at Providence with 120,000 caregivers, 52 hospitals, nearly 1,000 clinics, 5 million patients, health plans, schools, and housing across 7 Western states with values of compassion, dignity, justice, excellence, and integrity, providing vision, leadership, management, and execution of DEI efforts. Karen previously led diversity and inclusion for companies in Georgia and Ohio. Next, Michael Knecht is Executive Vice President, Chief Marketing and Communications Officer for RWJBarnabas Health, which, in partnership with Rutgers University, is New Jersey's largest academic system with 38,000 employees, 9,000 physicians, 15 adult and children's hospitals, the nation's largest pediatric rehab hospital, outpatient network, and the state's largest behavioral health network. Michael leads branding, marketing, internal and external communications, digital, and partnerships. Next, Amalia Stanton, Memorial Hermann Health System's Senior Vice President and Chief Strategic Communications and Marketing Officer. She drives growth, brand awareness, preference, and reputation for Houston's largest nonprofit health system, serving a highly diverse population with 17 hospitals, 270 care sites, 6,100 physicians, 29,000 employees, a health plan, and ACO. Previous work with global companies focused on issues management and corporate social responsibilities. So let's start off with each of you briefly learning and telling us more about the communities you serve. So Michael, New Jersey is among the most diverse and densely populated states, with your hospitals and care facilities located largely in urban communities with highly different populations. Can you please break it down?
The diversity is rich, as you said. We serve communities that are majority Black. We serve urban communities that are majority Hispanic. We have suburban communities. We even have one of our hospital facilities serves a population that's 50% Hispanic, 50% Orthodox Jewish. So as you can imagine, we serve a very diverse audience in a very compact geography.
Thank you. Amalia, like Jersey, Memorial Hermann's Houston market serves a population that's highly diverse. Tell us more.
Houston's a very diverse city, as you mentioned. Similarly, we have about 7.1 million people in the greater Houston area, which serves about 9 counties. The city of Houston itself has about 2.3 million residents. We are the 4th largest city in the United States, and nearly 1 in 4 Houstonians are foreign born. And what that breaks down to is that about 37.5% of our population is Hispanic, 33.7% white, 17% Black African American, 8.3% Asian, and then 3.7% makes the rest of it. So what that really means is that we are what one would consider a minority majority city.
Thanks so much. Karen, Providence's 7-state footprint represents numerous diverse populations, and like others, even within zip codes. How do you ensure your efforts are highly localized?
We have patients who represent cultures from across the globe, and we are intentional about ensuring that we honor all of the cultures that our patient populations represent.
Thanks so much. I want to ask each of you, how are you listening to diverse voices in your health system to improve equity internally and externally? Karen, I'm going to start with you because you went on a multi-month listening tour. Tell us a little bit about it and what you learned.
Sure. Well, I spent 5 months on the road, Rhoda, earlier this year, spending time with our caregivers, having quite candid conversations about the state of diversity, equity, and inclusion here at Providence. And I am so proud, once again, of our caregivers who participated in the listening tour. They gave themselves permission to be vulnerable and to be transparent and to share their lived experience in terms of diversity, equity, and inclusion. You know, from the listening tour, we learned that our caregivers are excited about this topic. They want to learn more. They want to have an opportunity to hear the experiences of caregivers across the Providence footprint. And so we're going to use the findings from this listening tour, Rhoda, to inform a multi-year DEI strategy so that we can move DEI forward here and further and faster here at Providence.
Thanks so much, Michael. Barnabas, RWJBarnabas has been at this for some time. Many of us know of your leadership's passion, especially in anti-racism and other issues. So how has it changed and what have you learned over the years?
Thanks, Rhoda. While the health system itself is only 6.5 years old, the members of the individual hospitals, have been around as long as 150 or more years in our communities. So we've got a long track record of listening and engaging with communities, both at the grassroots level, as well as other nonprofits in the community, to help shape what we do and how we do it. I think all of us in the health community, are accustomed to the community health needs assessment process, which we're all required to do. As the CHNA process has evolved, we've taken that data, and really amplified it once the system came together to develop statewide programs that can support not just our institutions, but also more importantly, our communities. We had a very robust DEI effort coming into the merger. We shared best practices once the system was formed. Things like affinity groups, listening tours that Karen just referenced, always part of our DNA at RWJBarnabas Health. And then over time, that data drove our social impact mission, which we focused on social determinants of health. From that, we took the DEI efforts, we took our social impact efforts, and as you mentioned, with the events surrounding the murder of George Floyd, all of those components, came to a head as we launched a very comprehensive anti-racism effort at the system.
Amalia, your system leadership had many listening tours that tackled many issues. Tell us more and some of your findings.
Memorial Hermann has had a long history in supporting EDI efforts. However, I would really offer that in about 2020, there was a concerted focus to really sit down and listen and hear from employees on how they felt we were doing and what we could do more. So 33 sessions, I think over 250 employees from all levels were engaged. Questions were asked like, what does diversity look like to you in your particular area at Memorial Hermann? What should we come up with a diversity statement? What would that look like? What areas do you want us to focus on? So it was very much about feedback from the employee base that really garnered a lot of effort, attention, and support. We took all of that information and consolidated it. There was a lot of support at the executive level. It was something that was very important to our CEO at his core. And we consolidated it all and created 3 councils, formulated a number of meetings, lots of listening sessions, ability for open and honest discussion, taking ideas, thoughts, and really sharing them. Some of them harder conversations that we hadn't had in the past, and really being able to be very honest and transparent and vulnerable, quite frankly, in much of what was discussed. There was an employer council, there was a system council, and there was a community one, all of which had different focuses. Employees were able to then take all of their thoughts, information, and start to garner strategies and see how we could take what we had done in a much more sort of a informal way and formalize it. That brought about really the creation of an Office of Diversity, Diversity, Equity, and Inclusion. The 3 areas that we are now extremely focused in on.
Great, thank you. Michael, I want to go back to you for a second. If you can talk a little bit about what you did with your local boards.
Surely. So one of the first initiatives once we came together as a system was to have our DEI leadership work with our nominating committee of our corporate board to establish guidelines around recruitment and retention of trustees. We have 14 acute care hospitals in our system, as well as a parent board, and we knew that our board composition was not reflective of the diverse communities that we serve. So we went on a very specific review process, taking demographics, educational levels achieved, race, ethnicity, all of that, and mapped our board composition against the local communities. We then worked very closely on the nominating process to assure that either we needed to expand additional board seats to more readily reflect our local boards composition to reflect their local communities, or as seats became vacated, we used that roadmap, to target recruit to make sure that we were going after trustees that were reflective of our communities. As a result, we've seen a dramatic increase in women trustees, as well as different races and ethnicities to better match the diverse state.
Thanks so much. I want to get into the fact that we all talk DEI, but some of us believe there's some missing letters. It's A for access to convenient quality care. It's without B for a sense of belongingness for staff, patients, and communities, and without T for transparency. DEI is no longer, it's meaningless, and it's just a wish without results. So share examples of what you're doing to improve access, belongingness, and transparency in your communities, especially in social determinants of health. Karen, please start.
The Black Birth Empowerment Initiative, that is a component of our Swedish doula program. We're very proud of that work that we're doing as it seeks to honor Black lives by centering and uplifting, the Black birth experience with culturally congruent doula care. So, just want the audience to know that that is something that we're very proud of. This is a program that was created to address the disparities in the Black community, including the disproportionately higher prenatal complications that we know all exist in this community, with stillbirths and postpartum complications and increased mortality rates for both the mother and the child. This BBEI program is for all Black American birthing parents who, visit all of our Swedish birth centers at First Hill, at Issaquah, and at Edmonds. So I just wanted to make sure, Rhoda, that, I share that program that we're so very proud of. It's a part of our efforts to ensure that we're addressing healthcare disparities and offering that access to health care that is so important to us.
Thanks so much. Amalia, talk about some of the things that you're doing in your community to improve access.
Absolutely. To advance Memorial Hermann's vision of creating healthier communities, Memorial Hermann's Community Benefit Corporation, they implement commitments that are built on the foundation of 4 pillars. The first is access to healthcare. So finding and creating access that is easy, emotional well-being. So being mindful of mental health, certainly food and health. So we know that there's a direct correlation between many of these individuals that are being affected by not having access to food or food shortage, and exercise as medicine, all are the 4 major pillars. Also, the Community Benefit Corporation is very focused in partnerships. We don't believe we can do this alone, and we think that the more that we work with others, government agencies, business leaders, community stakeholders, other like-minded individuals, we will be able to get quality outcomes and do it faster. So there's a big focus on creating trusting partnerships in the community. Additionally, we offer community education on social determinants of health. We try to make sure that that material is done in a mindful way of the audience, thinking about tone, messaging, simplicity, etc. We have began working with our vendor network to reach underrepresented groups. We are also very focused on school-based health centers, as well as neighborhood health centers and community resource centers. In addition, park revitalization. We know that if we can't if people can't get to a park and even try to exercise, there's no way that we're even going to be able to make it to the next level. So we're doing a lot of work in our community to try to revitalize parks that need to be helped.
We have been on the journey to address the social determinants of health for many, many years. Our social impact and community investment initiative, we have a very robust strategic plan, which is available on our website. And we address the different aspects of the social determinants. As I mentioned earlier in my remarks, we really have tried to look at umbrella functions that support the entire state, and then target things that are more reflective of the needs of each of our communities. So, for example, one of our major cities is designated as a food desert, and so we've established hydroponic greenhouses that act as farmers markets in the community. We also couple that with advocacy with the state, because in New Jersey at one point, folks in our community could not use their SNAP benefits at farmers markets. And so we worked with our legislative officials to change the regulations for all SNAP beneficiaries, that they could come to our greenhouse and use their dollars, to buy healthy fruits and vegetables that we ourselves have raised. We also focus on activity and general fitness. We've gone so far as to build soccer fields in urban areas that really didn't have access to activities for youngsters. And so we've partnered with municipalities to put up small soccer fields that's on our expense, in conjunction with a statewide soccer resource organization to build these, to work with our cities, to make these things accessible, to communities that really didn't have access to such facilities. That on top of things such as housing for displaced folks, it really runs the gamut.
Conversations can be difficult. People worry that they're going to say the wrong thing, so they don't say anything. How do we encourage participation and make people feel comfortable, while at the same time, in that same vein, many people get tripped up? They don't know the right words. They keep quiet. Is it Black? Is it African American? Is it Black American, or something else? Is it Hispanic, Latino, Mexican, Latinx? Is it Asian, or by country or region? Is it BIPOC? How do we address that and the way we communicate? So, Amalia, I'm going to start with you.
Yeah, I would offer that what we did was listen to our employees. Honestly, our employees represent pretty much all ethnicities, races, religions, all kinds of diversity. So we approach it that way. We've had lots of conversations between Hispanic, Latino, Latina, Hispanics, and there are varying opinions, quite frankly, African American or Black. Some people don't care for one or the other. What we've tried to do is try to be as inclusive as we could. So while it may take a few extra words, we, for example, usually refer to Black and African American, both, so that we can ensure that both, any individual that feels more of an affiliation or feels more comfortable with one or the other is represented. I think this is really about listening and not assuming we know, and really thinking about what's reflective. I think we always have to keep in mind and be mindful that we are not homogeneous. We all come from different backgrounds and different experiences. And so for me, for example, I'm Argentine, so I'm South American, and I like to be referred to as Hispanic. That doesn't mean I'm offended by Latina. It's just what my preference is. Whereas for me personally, Latinx is not a term that I relate to, so I would prefer not to be using that. I could offer that I could speak to a colleague who's also Hispanic or Latino, and they would have a different opinion. So I think it's about listening, hearing your audience, and really thinking about what's the best, most equitable way to make them feel valued and to show them that you're respectful of who they are, their heritage, race, or otherwise.
Thank you. Michael, your thoughts on that topic?
Yeah, thanks, Rhoda. It's been our president and our CEO, Barry Ostrowski, who established a board-level committee around social responsibility and anti-racism. And so that committee of our parent board is as powerful as the finance operations and HR committees that we all have in our organizations. And so by him setting the tone, by establishing a board committee to show that it's critical to have these conversations, and then providing education and spaces where people can come together and have these conversations. We've launched something called Equitable Encounters, which are monthly roundtables, virtual roundtables, where we bring in thought leaders from across the country to have conversations and make people of all levels of the organization, all backgrounds, come together and hear, what is commonly being discussed around the country. I think we all become insular at times, and we think that our problems and our issues are just ours. And by having global and national leaders come to us and share their experiences, often from other industries, I think we all know that healthcare tends to lag a little bit in adopting new concepts. And so, for example, the chair of our board committee is the chair of DEI for Merck. Again, a global powerhouse with locations all over the world. And she really sets the tone with our CEO for having these conversations.
Thanks so much. And Karen?
I believe that those of us who lead this work of diversity, equity, and inclusion, it is so important that we allow ourselves to be vulnerable and transparent as we lead this work. It's a journey and a learning experience for us as well. So I will tell you, Rhoda, that I learned something every day. And I understand that this conversation has become even more complicated. And so, one of the things that I always try to encourage, whether it's a colleague, whether it's a friend, whether it's a church member, is to not shy away from the conversation, to not let the lack of knowledge around this topic hold you back from joining in the conversation. I always try to do everything that I can and encourage others. Create a safe space for people to ask questions, and encourage everyone to stay curious, read books, listen to documentaries. When you're in the grocery store, maybe start a conversation with someone. Just ask questions and to know that it is okay. I try to encourage everyone. Don't let the fear of this conversation stop you from getting engaged. We know that fear is what? False expectations appearing real. False expectations appearing real. And a lot of times people, want to engage in conversation. They're just waiting on someone to ask the question. So I encourage everyone, don't allow the fear to be an excuse, right? To not step into the conversation, lean into it. And if you are afraid or scared, always say it's okay. Do it scared. Do it scared. And it's amazing when we start these conversations, we begin to learn that we have a lot more in common than we realize.
It's interesting. Anyone who's known me for more than an hour knows that I have spent most of my life rallying against the word minority. For me, minority means less than. And I don't think it should be a word to describe any human being. 2 years ago today, actually, the National Association of Hispanic Journalists advocated for stoppage of the word minority since it holds a connotation of an oppressed group and too often used to minimize historically marginalized people and promote erasure. I was talking to Amalia and I was telling her that one of my favorite public service announcements, which was only 10 seconds, if a woman's seated in a wheelchair and a voice in the background said, "Would you call a handicapped person?" She says, "My name is Mary." So I think, that's, and I'd like to actually, at this point, we'll have more questions. I'd like to call on each of you. I selected each of you because of the work you've done, because of passion you have for this topic, and because of who you are. So in just like 30 seconds, can you just talk about who you are and how that has impacted how you look at this issue? So Amalia, I'm starting with you.
Okay, I am a woman, I am Hispanic, I am Jewish, I am a Texan, I am an American. I think my parents were foreign born, so I'm a first generation American. My first language was Spanish. I am impacted by all of those things and more. I think that your experience, your heritage, your culture, your influences all impact how you view the world and how you perceive things. I, in particular, because of language, I am particularly cognizant of accents and making sure that that I don't speak with an accent, because I was witness to discrimination early on, intentional or not, for whatever reason. Sometimes in the past, people have misunderstood individuals who don't speak English correctly and interpreted it as less than. And so growing up, I was very careful to learn to not have an accent, so that that wouldn't be a stigma that I would have to overcome. And so I think that makes me even more cognizant of people's differences and being really thoughtful about not leaning into any sort of stereotypes.
Thanks. I'm getting teary because, you know, many of us have families that were immigrants that faced a lot of that kind of discrimination. So, Michael.
Surely. So, I guess if we're asking about how we identify, I am a white male, Protestant, grew up in a very small town in Pennsylvania where there was no diversity, either with religious, ethnic, cultural. It was very homogeneous. And I did not really experience anything new or different than people who looked like me until I went away to school in Philadelphia. And I went from that very small bubble to, you know, one of the most diverse, active cities in our country. And my world expanded greatly. Fast forward, I married a nice Jewish girl from New Jersey. Both of our children are Asian. And so I embrace, you know, the diversity at home, even though probably at the beginning of my life, this is not a path that one would have expected I landed. I think one of the things that I take, and why I'm so passionate about this topic, is that, you know, I consider myself, despite where I started and the lack of options and awareness that I admittedly have, and all of the biases that we all try to uncover and bring to the table, you know, I really consider myself to be a passionate ally. And I try to use my skills in marketing communications to advance those causes, to make those conversations more understandable, more safe, more comfortable.
So, Karen.
Sure. So I am Black, African American, female, straight ally, grew up in a Black Southern Baptist church. My dad was in the military, grew up in San Antonio, Texas. And I will tell you that growing up in San Antonio, where there is not a large Black or African American population, I relocated to Atlanta or in the early 2000s. And I will tell you, I believe that is when I really began to blossom. That was because in Atlanta, there is such a large Black African American population, and we are doing great things in Atlanta. And I needed to see the possibilities for Black people. I needed to see Black people serving in leadership roles in corporate America. I needed to see Black people serving as judges, as superintendents of school districts, as mayors, so on and so forth. And that, I'm going to say, just really opened up the possibilities for me and gave me the confidence that I needed to be where I am today. It required getting out of my comfort zone and leaving home and leaving San Antonio. So again, you know, as we speak about this work, it does require us giving ourselves permission to step out of our comfort zones.
Thanks so much. And thanks all of you for sharing that. So how do each of you infuse the right messages and visuals to represent communities that are too often represented and use storytelling to achieve your goals in the communications and marketing that you do? Michael, you start.
Thanks, Rhoda. Well, I think when we're talking about communications, and I know that building teams that are as diverse as the communities we serve help. So we're asking the right questions, but we also, put a lens at the beginning of any project that we begin to say, you need to really define the community that we're trying to target. And then that first exercise, while it may seem forced at the beginning, really has helped us identify, the imagery, the tones, the themes, and at the end, the channels that we use to reach the diverse audiences that we have. So, get starting your homework, and really focusing on those first sort of now almost perfunctory questions as to define your audience. I know it's what we do every day in marketing, but really making sure that it's not just we're talking about orthopedics or we're talking about cardiology, but it's like, but who are those audiences? What physicians are we talking about? How do we make sure that the physicians that we bring in to advance our communications are as diverse as the patients that we're serving? Again, it's, in some areas it's more easily done than others, but we force ourselves to have those conversations, and I think the end result, is a much more robust one. The other piece around the communications is all the topics that we're discussing now: DEI, social determinants of health, health equity, access, racism. We use these terms and we're knowledgeable because this is what we do. We understand that when we're sending out these messages, whether it's through social media, direct mail, TV, whatever it may be, we know that we could be confusing our audiences both internally and externally. And so at RWJBarnabas Health, we've tried to align these messages under one umbrella of health equity. We think that whether it's DEI, anti-racism, social determinants of health, global health, all of it's about equity and access at the end. And so we're trying to use that as an overall frame that's more accessible and understandable to our publics.
Wow, that's great. Maybe we should call it EAB: equity, access, and ensuring people feel some sense of belongingness. Amalia.
When we develop content, I think that the content has to be very specific and tailored to each audience. Gone are the days of taking something and just stamping it out for different audiences. You need to really think about who you're speaking with and tailor. Simplifying information so it's cognizant and really the message and tonality is appropriate, I think is beyond important. Certainly seeking and listening to informal feedback. So talking to people while you're developing, people who are reflective of that audience so that you can get knowledge, learn, make sure that your content is appropriate. And then obviously conducting research. Always active listening to those individuals who are represented or represent diverse perspective becomes just invaluable. And that's for visuals, language, tonality, messaging, word usage, etc. It is going to help you validate the content and that the message is actually resonating appropriately for the appropriate audience. Then you need to consider your reach, certainly the vehicles that you're going to use and which ones those audiences like. It's not the same for everyone. And then what's the variety? Because much like every audience, you have to go at it a bunch of different ways. So what is that, media mix that per se that you want to use? So that's kind of our formula for how we go about it.
Thanks so much. Karen.
With workforce populations that are looking for organizations to really be vocal in this space and to take a stand. For example, unfortunately, during the death of George Floyd, a lot of corporations were faced with, do we make a statement? Do we say something? Do we not say something? And of course, workforce populations, employees now are almost demanding that their companies speak out when such tragedies happen. So I will say that for us here at Providence, we are working collaboratively. We have a team and a partnership with our corporate communications team, our DEI leaders, in our Office of Diversity, Equity, and Inclusion, our caregiver resource groups, where we mobilize quickly when such tragedies happen, and we decide if it is to our advantage to make a statement, and if so, what that statement should be, what our messaging should be around the statement. So I think, Rhoda, that is going to become even more important for organizations and corporations as we continue moving through this journey of diversity, equity, and inclusion, and really being in tune to racial awareness, racial inequities, and where the organizations that we work for stand. So I would just like to add that to this part of the conversation. I think that's important going forward.
Thanks so much. You know, in thinking about this conversation, you all talked about your backgrounds. When I think my name, Rhoda, everything I do is around that name because I was named after my great-grandmother who, because of her religion, she and dozens of family members were killed because they were Jewish. And so I always grew up thinking we cannot let this happen to anybody else. And studying Black studies in college and all that kind of thing, and being from Detroit, I'm so personally appreciative of what all of you are doing. I'd like to have some final thoughts. So Karen, final thoughts on this topic.
Sure. So let me say thank you for the opportunity to join this conversation. And Michael and Amalia, it's been a privilege serving and sharing with you over the last few minutes and learning from you all about your personal as well as your professional journeys in this space. Rhoda, just want to say thank you so much for hosting this conversation. It is one that is critical and that is important to not just the healthcare industry, but to the industry, all industries across the board. You know, we're going to begin to see more and more of diverse populations. We're going to begin to just learn more about each other. I think we're just going to have to be forced to do that. So I think the more that we can have these conversations, the better we will be. So Rhoda, please continue hosting these conversations and making space for us to come together and share our experiences. So thank you.
And thank you, Michael.
Thanks, Rhoda. No, I echo what Karen said about having the opportunity and making new friends and colleagues here on this platform. I think what I take away is the fact that we hear about the negative so much, and the headlines, and a lot of us in communications and marketing, we focus on the things when they don't go well. I'm buoyed by the updates that I'm hearing here and across the country from colleagues on all the great work that's underway, and I'm very optimistic about that. And I know that it's very easy to become jaded and negative with headlines today, whether it's the pandemic or the political landscape, racial, injustice. There's a lot of great work, and there are a lot of people without even knowing that they're doing the same things. I think we saw a lot of the same threads, that presented today, and a lot of nodding about, yeah, I'm doing that too, and that's great. I'm going to reach out to Karen and Amalia now and steal shamelessly some of the things that I heard them doing, and I would welcome anyone to do that from any of us as well. But I'm very optimistic, and as I said, I think the work that's being done is amazing. I think everybody can get involved. It's never too late to advance that and use the skills that we have as marketing and communications professionals in particular to advance those conversations. It's what we do, and I can't think of anything more righteous or noble than advancing what we're talking about today.
Thank you. That's beautiful. Amalia.
I echo what my two colleagues here have said. To be honest with you, if you think about it, 10 years ago, would we be even having this panel discussion? And would we do it in such a way with pride? I have a lot of pride for my organization. I think Memorial Hermann Health System is truly having an authentic journey. And I think it's an inclusive one. And I think that we're just I'm lucky to be a part of it. I'm lucky to be able to see these incredible changes and this kind of a focused effort. And I think that if we continue to talk freely and we really bring this to the forefront, I think these conversations will all become safer. I think that my colleagues in the communications and marketing field are really working hard to try to authentically move this conversation. And I'm proud to be a part of it. So thank you for having me, and thank you for letting me join.
You know, I want a heartfelt thanks to each of you. As the prophet Hillel said, if I am not for myself, who will be for me? And if I am not for others, who am I? And if not now, when? And now is the best when ever. And it's so appreciated. It's such a blessing to see each of you and what you're doing and your passion. We're going to end this with a video that Amalia did at Memorial Hermann to promote equity, celebrate diversity, foster inclusion, what makes each and every one of us unique, respects our different ideas, perspectives, and values, and seizes the opportunity to lift us all up. So thank you for your time, and I hope you enjoyed this video and it moves you as much as it has moved so many of us. Thanks for your time today.
I am a mom.
I am a father.
I am a grandfather.
I am a wife.
I am a husband.
I am a daughter.
I am a sister.
I'm a brother.
I am an adoptive mom of a child from Eastern Europe who lights up our world.
I am a single father with a special needs son.
I am a first-generation Indian American.
I am from Colombia.
I am a Mexican American.
An Asian American.
African American.
Filipino, Chinese, and Hispanic.
I am an immigrant.
I am a born Pakistani.
I am Surinamese.
I am Black Lives Matter.
I am a little person.
I'm a disabled veteran.
I am a Black male nurse.
I am a Catholic.
I am a Christian Arab.
I am an American Ismaili Muslim.
I am a member of a faith community that loves me and accepts me exactly for who I am.
I am pansexual.
I am gay.
To me, diversity means that everyone is included.
It means love.
It means standing up for what I believe in.
It means putting myself in other people's shoes.
It is understanding.
It means respect.
It's acceptance of everyone around you, no matter the color, no matter the race, no matter the religion.
It means kindness to all.
It is being heard.
Taking care of each other.
A life that is vibrant with prosperity, vibrant of being safe.
Houston is known as a melting pot. We are very diverse and we have every walk of life. We have every different race, every different culture, every different background.
And because of the diversity of our workforce and the communities we serve, it is important for Memorial Hermann to celebrate what makes each of us unique, to respect different ideas, perspectives, and values, and to seize every opportunity to lift each other up.
I am Memorial Hermann.
Yo soy Memorial Hermann.
وأنا Memorial Hermann.
Ako ay Memorial Hermann.
मैं Memorial Hermann हूँ.
I am
Memorial Hermann.